Okay, so the Brittle Bone Society have asked me to talk about pain and exercise. So I'm not moving on. Do it that way. So the aim of today is to understand inactivity and deconditioning, which a few people talked about earlier. So that was very helpful. That's given me a bit of a way in. I want people to understand what is exercise and why we do it. Have a little bit of understanding about pain and what good pain and bad pain is. Talk again about pacing activity, but also getting that balance of activity and then maintaining fitness, trying to avoid that sort of boom and bust. And again, to make people aware, we're not suggesting everybody starts working towards running a marathon or doing couch to 5K or whatever, but actually ensuring people are fit for purpose. That works this time. So here's a few quotes. The best physio quote ever, I think, that's around is if you don't use it, you lose it. But there are a few others on here that nothing happens until something moves. I think my favourite one, and we'll come back to it at the end, is that it's not what you do every once in a while, it's what you do on a daily basis that makes a difference. And there's a couple of others on there for people to have a look at. So deconditioning, it states here, it refers to the change in the body that occurs during a period of inactivity. And I think we can safely say for the majority of people, particularly people shielding, that's what a lot of people have been doing over the last 12 plus months. And deconditioning, it doesn't happen overnight. It's a slow process where that reduction in activity leads to reduced endurance, reduced muscle strength. Somebody mentioned on the chat, reduced tone, and general reduced cardiovascular fitness. So it can arise simply from an injury and having to rest, or an illness, or sometimes a change in your circumstances, such as starting a new job, which is more sedentary, or at the moment, definitely, it's happened to a lot of people, and I've noticed it in an awful lot of my patients because of the lockdown and because of people having to shield. But there's one important fact with deconditioning is, although it's cyclic, as you can see in the diagram there, it is reversible, and there is a way to reverse that cycle and move back up. So this is my kind of version of the cycle of inactivity that I sometimes use when I'm describing this to my patients. So a period of inactivity leads to lots of things, and we've mentioned a few of them, but it reduces your range of movement and it reduces your strength and your cardiovascular fitness. And that then leads to a reduction in your functional ability and your ability to do certain things. And that reduction in functional ability means that you become deconditioned. And attached with deconditioned, when you then start to move back into doing increased exercise or increased activity, you start to feel some pain attached to that. And it's often due to the other things in this cycle, the reduced range of movement and strength and the reduced functional ability. And we'll come on to that in a little bit. And that, of course, if something hurts, you don't want to do it. So that then it lends itself to increased inactivity. And I think particularly with OI, a lot of my families and the children I treat, pain often means fracture, particularly for the younger ones. Once the children become teenagers, they'll often say to me whether they're fractured or not, and they tend to know before we've even got the x-ray up. But I think the younger children, something hurts, and last time it hurt, it was a fracture, so we don't do anything. And that tends to make that cycle have a greater effect. So we mentioned inactivity. So it can be, like at the moment, after lockdown, after people have shielded, but also following fracture, following a period of illness, potentially following pregnancy or an operation. So when you're inactive, you will get reduced range of movement. So if you're sat or you're laid down, a lot of the teenagers that I see, I think, have homeschooled, and that's resulted in laying in bed with your laptop to the side of you and attending school lessons in your pajamas. It certainly has in my house anyway, with my 2 teenagers. So if you do that, or you sit in one position for a huge amount of time, I know schools have put online lessons, and if you're in secondary school, they've literally followed the timetable, and so you've sat for an hour for each lesson and potentially not moved in between. So you will get reduced range of movement. You will start to find when you stand up that your hips are sore, your back is sore, your knees feel stiff. But alongside that reduced range of movement, you get reduced muscle length. So people will know without the inactivity, if you sit in a wheelchair for a long period of time, I notice it particularly with my teenagers when they go to secondary school and they need a wheelchair to get about because the campus is so much bigger. They then start to get reduced muscle length in the front of their hips, in their hip flexors. And I'm forever telling or asking people to stretch, and I'm sure they're sick of it. But along with that, you've got reduced muscle strength and reduced muscle bulk, and all of that leads to reduced function. And again, the less you move, the less able your cardiovascular system is to cope with movement and activity. And so you get a reduction of that. And as we've said already, it's cyclic. So how do we break the cycle of inactivity? The list is exhaustive, huge, and varied. Exercise, I think it's important to know, and I've put that quote up again because it is the physio quote people have been using for decades. If you don't use it, you lose it. So anything that is above normal activity for that individual is a form of exercise. Anything that increases your heart rate or involves you moving more or moving differently is a form of exercise. And so I think we need to get out of the mindset of thinking, if I exercise, I've got to be going to the gym, going swimming, walking a long distance, going on the treadmill, all those sorts of things. Because for people who use wheelchairs for the greatest part of their mobility, sometimes exercise is doing arm exercises in that situation, or coming out of your chair and using something like bottom shuffling on the floor. And excuse me, I often ask my younger children to do bottom shuffling laps of the lounge and have bottom shuffle races and things like that. And all of that is exercises. I've got to put stretches on there because I think I mention them every day. It's important, because of the inactivity people have had recently, to stretch out a little bit before you do exercise. If you've been sat down for a very long period of time and you're going to stand up and decide to meet a friend and go for a walk, you're probably going to notice afterwards that your muscles feel tight, and that's potentially because you need a bit of a stretch. For some people, doing transfers is a form of exercise, and if you would normally maybe do transfers 2 or 3 times a day, then potentially one of your goals for exercise should be to double that. Walking is great. Swimming, of course, is fantastic for people with OI, and I know some of the swimming pools are starting to reopen again. But propelling your wheelchair, going cycling, doing some Pilates or yoga type activities, which I know certainly Carrie in our team put some videos out there with the help of the BBS. But doing things like that is great. Or racket sports, you know, trying some light weights. And dare I add on the end, cleaning. Okay, so a little bit about pain. Pain, you will know this, and people have talked about it this morning, particularly Elaine when she was talking about having OI. You know, people with OI tend to know if they've had a fracture. And so there are 2 types of pain in my mind as a physiotherapist. There is pain that's telling you to stop. So that might be a fracture. It may be swelling or some inflammation. It may be a repetitive injury, something like some Achilles tendonitis or something like that. Or it may be nerve root pain that's coming potentially from a problem in your back. And that for me is pain that tells you the activity that you're doing at the minute, you need to stop it. But there is also pain that I think, particularly for children with OI, gets tied up in that I've got pain, it must be a fracture, so I must stop what I'm doing. And so if you start doing a new activity, you will get muscle fatigue and muscle tightness, and they can lead you to pain. And having a muscle imbalance can also provide you with pain. So if the muscles on the front of your legs work much stronger than the muscles on the back, that can lead you to having knee pain. But those sorts of pains are pains to have a think about, perhaps have a talk to a health professional about, and try and put strategies in place to deal with, to enable you to maintain this increased exercise or activity. And one of the main things I think when we start to talk about increasing your activity level, if you've been in lockdown or you've been shielding, is that it's really, really important to pace activity. So like Lisa just said, doing a little bit each day is really important. You need to understand your own capabilities. And a few people this morning have already said, we have OI. We're aware of our capabilities. We really, really understand our bodies. So if you increase your activity and you get a bit of pain and you think it might be muscle ache, it might be fatigue, you might need a stretch, then seek some help from a physiotherapist, an exercise therapist, or somebody like that. So starting with low intensity for a short period of time. My teenagers are great. They think to do exercise, you have to go on the treadmill every day for about 30 minutes. You don't have any rest days, and you wonder by the end of the week that you're absolutely shattered. And I try and explain to them that that's just not maintainable. So start with really low intensity and start just doing short amounts of time. And for me, I tend to tell people who've been inactive for a long time that it's best to start introducing one thing at a time. If you decide you're going to start going outside in your wheelchair and you're going to propel for a mile, and then you're going to come back home and you're going to do some yoga, and then you're going to do a whole load of cleaning, the following day when you ache, you won't know which one did it. Or it makes it more difficult to sort out what you need to do to improve it. So if you choose one activity at a time and you start it with low intensity and you go out for that walk for maybe a mile, maybe half a mile, but you manage that and you feel perfectly fine the next day, you know that you can increase that next time. And that understanding your own capabilities and understanding your own baseline for that activity is really useful. What is also really, really useful is having rest days. Exercising every day tends to lead to repetitive problems. It's not maintainable long term, and it's much more sensible to increase your activity very slowly and have rest days in between. And of course, eating well and sleeping well, it really helps. And for me, one of the most important things with increasing your activity and exercise is find something that fits. So this is different for different people and completely depends on your lifestyle. It also depends on your capability, but some things, what you need to do is find something that you can fit into your life 3 or 4 times a week. So potentially park further away from your destination so that you have to do a bit of increased activity to get there. Maybe walk, propel, or bike to work, school, or college. Exercise with your friends or your family to make it more fun. Activity with music, or exercise whilst you're watching a regular TV programme. I hate to say it, but I quite like having a bit of a run with a crime drama, but we'll keep that between us. And make it fun, make it reproducible, and make it regular. Remembering to have those rest days, eat well, sleep well, and pace your activity. And Lisa and I obviously had similar thoughts on our slides. I come back to that quote. It's not what you do every once in a while. It's what you do on a daily basis that makes the difference. It's really important with exercise not to make it arduous, make it fun, make it fit in with life, and then it makes it reproducible. I hope that helps, and thank you for listening.
That was really great, Claire. Really, actually inspiring. It's nice how we've got the similar theme of taking control and actually planning what you want to do. We've only got a few minutes. Do you just want to touch on the other aspect of deconditioning? That's the deconditioning of motivation, which I think many of the people I look at, it's the mental and physical. It's that, that we've lost that oomph to do things even though it's really hard. Do you want to talk about your experience or tips we can give our audience for that?
I think that's why you need to pick something that you enjoy, or something that you can do with somebody else so that they can encourage you to do it as well. And I think maybe it's trying those things and realizing that you've become a bit deconditioned and you're inactive, and knowing within yourself that you want to improve, and that potentially is the motivation to get moving again. But I think for me, it's got to fit with your life.
And it's that daily repetition that's so important.
Yeah.
Have you had any experience of how that's sort of influenced the impact of pain in the people that you see? That sort of deconditioning physically and mentally?
Definitely. We've had quite a lot of children who've come back following, particularly, I think, like Lisa said, that lockdown following Christmas, when the weather was bad, nobody wanted to go out in the garden, everybody was inside. Schools had got to that stage where they were able to do a lot of things online, and kids like accessing things that way. And that made people very inactive. And I think a lot of our patients came complaining about pain. We had some children who'd not been, I suppose it links in a little bit to the scoliosis talk and the seating and being at home, but a lot of children hadn't had or had struggled to get the right equipment from school that they would have had when they sit at school, and had been at home just laying on the couch or whatever to do school. And so a lot of people were complaining of back pain and limb pain because of that. So I think we did quite a bit of work of getting the right equipment at home and encouraging people to stretch a little and increase their activity. And so we have spent a lot of time talking to children and families about that, about, as the weather improves, starting to get out a little bit more.